Hi, I'm Dr. Jeremy Pettis, and I am here with my good friend and colleague, Dr. Steve Edelman. We both developed type 1 diabetes at the age of 15, and we spend most of our time treating people living with diabetes.
Now, before we begin, I wanted to remind you to please see the full prescribing information and medication guide, including the box warning at afrezza.com/safety.
Now, Steve, you and we both use Afrezza, so tell our viewers, what exactly is Afrezza?
Well, Afrezza is a powdered human insulin that is inhaled into your lungs. Afrezza addresses an important unmet need in that it has a unique rapid on, rapid off time course of action. This leads to better post-meal glucose values and less delayed hypoglycemia 2 to 5 hours after a meal.
Yep. So Afrezza starts working in about 1 minute. It starts to lower your blood glucose levels within about 12 minutes and peaks in 45 minutes. Depending on the dose of Afrezza, it's out of your system in about 90 minutes to 3 hours.
Wow. For people with type 1 diabetes, it can really help to keep your glucose levels from going out of range. Less highs, less lows. Some of our patients use it for their only mealtime insulin, while others use it also to correct for elevated blood sugars. We use Afrezza for both meals and correction doses. Of course, any type 1 will continue to use his or her basal insulin.
Now, for people with type 2 diabetes, they can also enjoy the same benefits as us folks with type 1 and can control their post-meal highs without the need for an injection.
It is definitely convenient. Jeremy, tell us how to use and how to dose Afrezza.
Yeah, so before meals, I suggest taking it with the start of your meal since it works so quickly. Occasionally, you may need to take what we call a correction dose later after the meal if your blood sugar values start to kind of creep up. But this really depends on what and how much you've eaten for a given meal.
Dosing is important. Afrezza comes in cartridges that hold 4, 8, and 12 units of inhaled insulin. But these are not units comparable to subcutaneous insulin that many of you may be on. Consult your doctor for proper titration.
So, you mentioned it comes in 4, 8, and 12 units, just showing people what that looks like. They come in these kind of big packs. So this is actually 4, which is also color-coded. So the 4s are blue, the 8s are green, and the yellows are 12. You can tell these are loved because I've been using these. And then when you open these, they come in like 3 cartridges per a little blister pack. So here's the 4s, the 8s, and the 12s. And then when you want to take a dose, you pop one of these out, and Steve, show them how it's done.
Yeah. Here's the little inhaler.
Now this is a used cartridge already, so don't worry about Steve going low during that video.
And basically, right before you close it, you get ready, you put it in your mouth, you snap it closed, and you do an inhalation.
That was mesmerizing. And it's important to do that kind of, nice, gentle inhalation. Sometimes people try to inhale really roughly. You don't need that much, kind of power to inhale it. So thanks for showing us that.
Yeah, you're welcome.
So, with that in mind, it's important for us to go over some safety information for everybody to know with Afrezza. So here goes. So Afrezza must be used with long-acting insulin in people who have type 1 diabetes. A spirometry test of lung function is required before you start Afrezza, then 6 months later, followed by a yearly test, which takes only a few minutes and can be done in most doctors' offices. It's not known if Afrezza is safe and effective in children under the age of 18. Now, Afrezza is a rapid-acting inhaled insulin used to control high blood sugars in adults with diabetes. Afrezza can cause serious side effects, including sudden lung problems and low potassium. Afrezza is not for patients with chronic lung disease, such as asthma or COPD. So tell your doctor if you smoke, recently stopped smoking, have ever had kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. The most common side effects are low blood sugar, cough, and sore throat. A severe low blood sugar can be fatal, so do not replace long-acting insulin with Afrezza. Afrezza is not for the use to treat diabetic ketoacidosis. Do not take Afrezza if you're allergic to insulin. Talk to your doctor before changing your Afrezza dose. Blood sugar may need to be checked more frequently, so please have a discussion with your healthcare provider regarding your use of Afrezza.
Thank you. This video was produced in partnership with Mankind, the makers of Afrezza, as part of a paid sponsorship. Please know that results may vary, and please consult your doctor to learn more about Afrezza and to find out if it may be an option for you.
Yeah, so that's it. Thanks, Steve, for the demonstration, and so long for now, everybody.